Transforming rotator cuff surgery, the role of PRP, Regeneten, and BioBrace bioinductive patches. Good morning, everyone. Today, we'll delve into the evolving landscape of rotator cuff surgery, focusing on how platelet-rich plasma, Regeneten, and BioBrace bioinductive patches are transforming treatment outcomes. Rotator cuff tears are a common source of shoulder pain and dysfunction, particularly in middle-aged and older individuals. While conservative treatments are often the first line, surgical intervention becomes necessary when symptoms persist. Our goal in surgery is not just to repair the tear, but to achieve durable healing and a rapid return to function. Introduction to rotator cuff tears. The rotator cuff consists of four muscles and their tendons: supraspinatus, infraspinatus, teres minor, and subscapularis. Tears in these tendons are a major cause of shoulder pain and functional impairment. Despite advances in surgical techniques, re-tear rates remain a significant concern, varying from 10% to 75%. This high failure rate might be related to biological issues both at the bone-tendon junction and in the tendon tissue itself due to underlying tendinopathy. We are constantly seeking ways to improve these biological healing processes. Platelet-rich plasma in rotator cuff repair. One biological augmentation strategy that has gained considerable attention is platelet-rich plasma, or PRP. Contains high platelet concentrations derived from the patient's own blood. Upon activation, these platelets release a rich cocktail of growth factors like transforming growth factor beta, fibroblast growth factor, platelet-derived growth factor, vascular endothelial growth factor, connective tissue growth factors, and epidermal growth factors. These growth factors participate in the tissue repair process, induce mitosis, extracellular matrix production, neovascularization, cell maturation, and differentiation. The idea is to enhance the healing potential of the tendon to the bone. Promising findings. For instance, a randomized controlled trial by Pandey et al. Demonstrated that moderately concentrated PRP significantly reduced VAS pain scores at 1, 3, and 6 months post-operatively. They also observed significantly better constant Merle scores at 12 and 24 months, and UCLA scores at 6 and 12 months in the PRP group. Most notably, the re-tear rate in the PRP group was significantly lower, 3.8%, compared to the control group, 20%, at 24 months, particularly for large tears. This suggests PRP can accelerate vascularity around the repair site in the early phase. However, ASES scores were comparable between groups at all times. Bioinductive Collagen Implants, Regeneten. Moving beyond PRP, bioinductive collagen implants have emerged as a significant advancement. Regeneten, a specific bioinductive collagen implant, has demonstrated promising clinical outcomes by stimulating new tissue formation and improving tendon integrity. The bioinductive collagen implant is positioned on the bursal surface, where it supports collagen deposition and tendon regeneration. Clinical outcomes with Regeneten. A recent study evaluating Regeneten for bursal-sided partial thickness rotator cuff tears showed encouraging results. Patients experienced a significant reduction in postoperative pain, with VAS scores improving as early as 2 weeks post-surgery. Functional outcomes, as measured by ASES, SANE, and WORC scores, showed significant and continuous improvement from 6 weeks post-operatively. Importantly, radiological evaluations at 6 and 12 months showed no cases of graft failure or re-tear, indicating successful healing. This approach facilitated rapid recovery without a significant risk of complications, and allowed for earlier rehabilitation compared to conventional repair methods. Introducing BioBrace, a biocomposite scaffold. Now, let's turn our attention to BioBrace, a novel biocomposite scaffold developed as a biologic and mechanical augment to reinforce soft tissue where weakness exists. What makes BioBrace unique is its dual nature. It is composed of a collagen sponge reinforced with PLLA microfilaments. The PLLA microfilaments provide initial strength and a structural framework, while the highly porous collagen sponge facilitates host tissue proliferation, maturation, and remodeling. This design allows for both mechanical load sharing and biological augmentation. BioBrace, mechanical and biological advantages. BioBrace is designed to address a critical balance in tissue repair, providing immediate mechanical reinforcement while promoting long-term biological healing. It offers remarkable strength for its weight. For example, a 23mm BioBrace has a strength of 515 N, 115 pounds. This is significantly stronger than a simple stitch, 35 N, or a mattress stitch, 62 N. Crucially, BioBrace's stiffness allows it to load share with the repaired tissue, preventing stress shielding which can hinder the body's natural healing capacity. The porous structure also significantly increases graft volume, rotator cuff tendon thickness, 180% increase, as demonstrated in preclinical studies. BioBrace protects early repairs and provides supplemental strength for up to 2 years before fully resorbing. Clinical evidence of BioBrace. A retrospective chart review of 267 patients using BioBrace across various procedures, including rotator cuff repair, has shown very positive results. For rotator cuff repairs, the retear rate was notably low at 3.8%. This is encouraging, especially when considering that general retear rates can range from 7.2% to 94%. Patients reported statistically significant and clinically meaningful improvements in pain reduction and functional outcomes, as measured by ASES and UCLA scores. Importantly, no intraoperative complications or device malfunctions were reported, and none of the adverse events were determined by the surgeon investigators to be due to BioBrace. This implant is proving to be a versatile solution for soft tissue augmentation. Conclusion and future directions. In conclusion, the integration of biological and biocomposite materials like PRP, Regeneten, and BioBrace is fundamentally changing how we approach rotator cuff surgery. While PRP offers promising early pain relief and reduced retears for large tears, bioinductive collagen implants like Regeneten and BioBrace provide both biological stimulation for tissue regeneration and mechanical reinforcement. These innovations promise to lead to even better patient outcomes, faster rehabilitation, and a more confident return to activity for individuals suffering from rotator cuff tears. Thank you.